All right, so thanks everybody for joining us for this webinar, the Welfare for Wildlife webinars that we've been running with global animal welfare and wild welfare. So it gives me great pleasure to introduce today's speaker. So it's Dr. Jen O'Dwyer. So she's currently the Associate Veterinarian for Zoos Victoria. And I've had the great pleasure of working with Jen over the years. We're in Asia, working for Animals Asia. So Jen graduated from Melbourne University in 1999. And so she started as a mixed animal clinician, including time working in the
Is Nick frozen for everyone? Give her a second to come back. Well, hopefully that's the only glitch for the webinar. But it's not a good start, but it gives people a bit more time to join us, I guess. So while we're waiting for Nick to rejoin, I'll
UK during foot and mouth. Oh, what happened then?
So you froze for about 30 seconds then, Nick.
Oh, okay. Can you hear me okay now?
Yeah.
I don't know where I got up to.
It was literally at the start, so I don't know if you want to just start again.
Foot and mouth. Oh, okay. So yes, I was just saying how wonderful Jen was. She graduated from Melbourne University in 1999, started as a mixed animal clinician, including time working in the UK during foot and mouth outbreak. So since 2007, she's worked in both China and Vietnam with Animals Asia, where I had the good pleasure of meeting her and working with her. And that's where she was working with rescue and rehabilitation of bears from bear bile trade, assisting with the care and of several other wildlife species during that time throughout Asia. So she's worked at Perth Zoo and at all three of Zoos Victoria properties for the past 6 years, providing veterinary care for a range of species, both exotic and native within those collections, as well as daily wildlife presentations from members of the public. Outside of work, Jen has participated in a volunteer capacity for multiple masters and PhD students fieldwork projects involving multiple Australian wildlife species, including the eastern barred bandicoots, koalas and kangaroos. And Jen has undertaken further study in wildlife medicine and welfare with a master's in conservation medicine from Murdoch University and a master's in international animal welfare ethics and law from Edinburgh University. So Jen is super passionate about ensuring the welfare of the individual whilst ensuring broader scale conservation outcomes for wildlife. And she actually has time for fun as well after doing all of those things. I love scuba diving and hanging out with her fur family and her human family as well. But over to you, Jen.
Thank you very much, Nick. And thank you so much for having me here today. It's an absolute pleasure and definitely a privilege. I'd just like to begin today by acknowledging the Wadawurrung people, the traditional custodians of the land on which we meet today, and pay my respects to their elders past, present and emerging. I extend that respect to Aboriginal and Torres Strait Islander peoples here today. And I'd also like to acknowledge some people who really helped shape how I work professionally and how I act. Jill Robinson and Gabby Fredrickson are two of the smartest, most courageous, kind, generous, and just plain old considerate people I know. I've been lucky enough to work with them both and call them friends for over 15 years. 3 other women who've also influenced me in very positive ways, not surprisingly, are all women who have been part of wild welfare and global animal welfare. the two wonderful organisations who've allowed me to be a small part of their outreach today. Okay, so the thought of giving this talk today was quite daunting, as even though I've been a vet for over 22 years and working with wildlife predominantly since 2007, it still feels like there's just so much to learn. And every day is a school day, so hence the title. You literally never stop learning. The scope of what it is to be a wildlife vet is huge. And to me, the key is constantly pushing yourself, constantly learning, being keen to be an active part in ensuring not only great conservation outcomes, but also great welfare outcomes. And that's what I'm hoping that we can have a chat about today. My years as a vet have been in small animal settings, large animal settings, rescue and rehabilitation, as well as zoological settings. And all of these have helped shape who I am. I also just wanted to acknowledge that there are quite a few potentially confronting images during this presentation today with postmortems, etc. Okay, so what does it look like to be a wildlife vet? There's lots of memes going around, and this would be a great one that a lot of people would think this is what it's like to be a wildlife vet. And I'm actually lucky enough that I do get to do this on a regular basis. But in reality, this is what we spend most of a great deal of our time doing. So postmortems to help educate and understand the why behind an animal died or why we needed to euthanize. Also on the right, you can see feces. So fecal examinations to try and proactively and non-invasively look into the health of animals. And to the latter part of this work, a huge asset are the amazing vet nurses who often take on the task of examining routine fecals and have a wealth of knowledge in this field. Now, to start to unfold what it is to be a wildlife vet, I see 4 components that feed into the decision-making and conversations that we're having daily. So who are the patients we're seeing and who are the clients that we're servicing? Also, how do we look after these patients' welfare as well as providing conservation outcomes? In my view and experience, it's not always easy questions to answer or answer in a way that works for the patient as well as the client. It's most certainly a collaborative effort, and that allows, if the vet's part of that team, that allows for great welfare outcomes. I'm going to present some patient and client examples that demonstrate differing people's life experience, expertise, and ethics that underpin what outcome we anticipate. Today's talk's not about me presenting my decisions or approaches to cases or what's right or wrong. It's to get us thinking about all the possible outcomes or concerns based on those 4 components of who the patient is, who the client is, conservation goals, and welfare goals. Together, we can definitely achieve great things. We just need to be prepared to get to know who and why we're interacting with the animal in front of us and always have welfare firmly in the forefront of our minds. The other thing we need to think about is how are we considering welfare? Which framework are we using? And here I'm going to be using the 5 domains model created by Professor David Mellor. This model is also adapted by the World Association of Zoos and Aquariums in their animal welfare strategy. We can see that addressing the medical or health needs of these animals is but one area of welfare to address. We also need to collaborate to ensure nutritional, environmental, and behavioural needs are met to allow our animals to thrive mentally. This again can be quite challenging, particularly with wild animals versus captive born species. And I do see the last point as a huge area for development and consultation moving forward. Okay, so let's start to look at who are our patients. And the patient list is vast. Working in private practice, a small animal or farming vet will be met on a regular basis with a variety of Australian wildlife and possibly an exotic pet such as a rabbit or a ferret or even a bearded dragon. Working overseas for Animals Asia, the majority of my patient list are Asiatic black bears, but also sun bears, brown bears, and the occasional local wildlife patient, such as a snake, a bird, or a bat. And of course, animals within local captive settings, such as tigers, leopard cats, and more. Working within zoo and wildlife facilities, the list is huge. From rhinoceros to orange-bellied parrot to ibis to all of the species you see on this slide and many, many more. And as you can imagine, the challenge of knowing the anatomy, anesthesia, and analgesia options alone for all of these species is a lifetime learning undertaking. And as with most things within veterinary medicine, it's vital to continue to read, to adapt to new techniques, new understandings of pharmacokinetics of medications, and new behavioural information as it's discovered. This education helps to allow good clinical decision-making in terms of prognosis and treatment options. But in reality, depending on the setting we're in, our ability to access and utilise these resources will vary enormously. So our school day might be reaching out to a colleague or a network for life experience where the literature may in fact be missing. It might be consulting with a human surgeon on the best technique to use for an orangutan. So we have to consider where our patient came from and can it go back there? How can that animal be housed appropriately in care? Do we have staff or carers with the adequate skill sets for this particular species? And do we as the veterinarian have the skill set to appropriately work up and treat any medical or surgical conditions? And is that even the appropriate treatment course for that particular individual? And so importantly, can this animal be appropriately rehabilitated for return to the wild? We should never just fixate on the cool surgery that could be done. It must be a holistic approach to every single animal. Different cultures, legislation, and in some cases, time pressures will influence what can and can't be done to help that individual's welfare state. In the private practice setting, there may be immense time pressures to attend to the paying client's patients, and wildlife patients can be kept waiting. Working in different areas of the world, euthanasia is not always culturally or legally an acceptable outcome for an animal. And then working in a world-class veterinary department where resources are focused to provide for all these animals, the conversation may be around, is it actually in the best interest of that individual's welfare to not euthanize it? So this leads me on to who is our client? And to name a few, your patient may come from a member of the public, a volunteer transporter, a wildlife carer, a small animal veterinarian, a government department or official, or a colleague that you work with. And straight away, we can see that the expectations, experience, and outcome focus may differ wildly based on how your patient ended up in front of you for examination. It also starts to introduce the ethical considerations faced on a daily basis and how, depending on these factors such as life experience, culture, education, and more, that these ethics vary between each and every one of us. So although some of these cases would seem straightforward and simple, and sometimes they are, I rarely find that to be the case. I'm going to present a few scenarios and provide my clinical evaluation. But on top of this, each of us will have different considerations that influence the outcome we seek or consider appropriate. Now, they're hypothetical situations, and in fact, they're probably a lot more black and white than what presentations we actually see in practice. Okay, so to start with, we've got a member of the public, and they've brought in this lovely raven that they've hand-reared after seeing a movie where a family brought home a bird from the wild to rear as part of their family. They're not wildlife carers, and they're not licensed to house any wildlife. Their concern is they're wondering why the feathers haven't grown properly. So bloods and radiographs show evidence of metabolic bone disease. and there are many areas of disease and pathology in this bird. This bird is also now very much a humanized animal. A volunteer transporter. He's driven 4 hours unpaid to collect a large eastern grey kangaroo to bring to you. It's come from an overpopulated area and has been hanging and thrashing from a barbed wire fence for over 12 hours. He's hoping we can treat the foot and release. Now, kangaroos, as you know, hop to get around. Straight up, we can see that there's a significant injury to the main weight-bearing area of the hind leg. Kangaroos are also exquisitely sensitive to capture myopathy, which can also lead to kidney failure. Housing for a large wild kangaroo is quite difficult and also can exacerbate capture myopathy further. A lovely wildlife carer brings you an adult koala from an area where this species is overpopulated due to lack of habitat. There are clear indicators to show the adult is emaciated, and as you can see on the right-hand side there, it has a dark staining around its cloaca or bottom. There's a misconception that the animal will be euthanized due to where it came from, but the body condition is often a result of underlying disease process. For koalas, chlamydia can absolutely lead to chronic debilitation, pain, suffering, and emaciation. Ultrasound confirms a thickened bladder and large cysts on this female's ovaries, and they're both clinical findings associated with chlamydiasis. A small animal clinician sends over an entire male possum that they have assessed and deemed needs further investigation. The animal's been attacked by a cat the night before. And as we can see, this animal has multiple bite wounds all over its body. These wounds can lead to systemic spread of bacteria, sepsis, and considerable pain. This is also a male possum who will be rapidly displaced from his territory back out in the wild. And lastly, we have a government department who they want you to fix their tiger. This cage is the life and home for this tiger 24/7. Simple and non-invasive hair plucks allowed for ringworm to be diagnosed. This diagnosis also allowed for the beginning of a trust relationship and collaboration to look at all 5 welfare domains of this tiger. Okay, so for all these scenarios, the knowledge bank that you're constantly adding to allows a thorough and tailored diagnostic approach to each individual. That knowledge base also looks at prognostic indicators and considerations for release. The client may be in full agreement with your clinical decision-making, but that's not always the case. And that's not to say that anyone wants an animal to suffer, but again, we need to consider that there are always differing ethics, education, and life experience that guide each person's perspective on best welfare outcomes. And this is where I see the huge need for learning and sharing of ideas and thoughts. And it piggybacks very much on what wild welfare and global animal welfare do so well on a global level. What they're doing is a participatory and inclusive approach to working towards great welfare outcomes for their patients with their stakeholders, and in my case, clients. I see this a huge part of my learning on a daily, small scale level. So next, how do we fit into the conservation picture? We may be dealing with threatened or endangered species. Whilst considering the individual welfare needs of that animal, we also need to consider how this individual might contribute to the overall conservation of the species. In this case, one orange-bellied parrot with a fractured wing may make all the difference to breeding efforts for this species and its survival from extinction. Once again, a collaboration was undertaken with keepers and conservationists who have vast skills and knowledge in their fields of expertise. By ensuring we as vets work with these teams to provide best nutritional, environmental and behavioural needs alongside with the medical care that we're providing, we can ensure not only great welfare outcome for this animal, but great conservation outcomes. And this little guy did great with the help of one of my fantastic colleagues, surgical skills, and a team effort in rehabilitation afterwards. Okay, so on to welfare and the many considerations that feed into this. Now, we need to be mindful that conservation of some species can be afforded by the eradication of other species. As a wildlife veterinarian, this is where I see an opportunity to ensure good conservation outcomes, but also working as best we can towards good welfare outcomes, even for the species we may be looking to remove from our ecosystems. These species may have either been introduced or in excessive numbers due to readily available resources that we actually provide for them inadvertently. The big picture can often look at the conservation outcomes of removing these types of species, but not always is the welfare of the individuals part of the conversation. Again, as wildlife vets, we absolutely should make a point of becoming an active part of the conversation in moving towards approaches that consider and address the individual welfare of the animals we're impacting. In many instances, removal of resources by closing bins or fencing, along with removal of nesting and denning materials, can go a long way. Also working alongside welfare specialists who analyse the welfare risks of different strategies and follow up to ensure that the strategies utilised over time are actually reducing population numbers, as well as providing humane deaths. So this slide shows a model that's been developed by Sharp and Saunders, and it's part of the Australian Welfare Strategy. These models assess the relative humaneness of various animal control measures. This particular model is for fox control. Just to briefly explain, on the vertical axis, the welfare impact prior to death is scaled from no suffering to significant suffering, and the horizontal axis is the welfare impact of the method of death, again from no suffering to significant suffering. So the green area has the least welfare impacts upon the animal, and the dark red, the greatest welfare impacts upon the animal. We also need to ensure the welfare of the prey animals that we're feeding out to the animals in our care. This is a deceased adult female rat and her fetuses, and it will be eaten by an eagle in care. We want to provide best practice, not only for the health of the eagle that's being fed the rats, but also a quick and humane death for these prey animals themselves. As a wildlife vet, we're caring for captive and wild species, and the latter can be incredibly complex to allow these animals to thrive whilst in our care. We don't have the same relationship with these animals that allow for training opportunities, and even confinement itself can be very stressful. Each and every case needs to be considered individually. One setup or protocol does not fit all birds or all turtles, or in this case here, all spiders. Look for opportunities to decrease handling, to allow for more naturalistic environments, and transitioning diets to allow for physical and mental adaptation. Okay, so also we need to think about who we're treating. One sore foot is not all the same. On the left, we have a hippo, and on the right, an eastern barred bandicoot. The approach taken for each needs to be based on the risks and benefits of those interventions for that animal's welfare. For the hippo, the risk and expertise required for anaesthesia is considerable. So can we find solutions to diagnose and treat that are less invasive and less intrusive? So with collaboration with our keepers, one of which was an avid photographer, he was able to capture this brilliant image to pinpoint literally the source of this hippo's lameness and allow for a treatment plan. In the case of the eastern bar bandicoot on the right, we're able to safely anaesthetize this animal to very closely inspect and radiograph the injured toe, which for this individual allowed for a better treatment plan. Okay, so we started out this chat stating that so much of what we do is postmortems, and sad to say, my catalogue of postmortem photos is immense. But this process is key to helping guide decision-making and prognostics on my next case and build evidence from the inside when oftentimes there's nothing at all visible on the outside. So on the left, we can see a video of a koala skull with a fractured jaw. It might be hard to see, but it's just off to the left there. And it's been after being hit by a car. But what we can't see is that fracture line extended not only up and down the bone, but along its entire length for some distance. This part of the fracture might have been missed, and reviewing these cases at postmortem helps to match what we're seeing with our diagnostics and what the true pathology actually is. On the right, another example, the insides of a koala picked up and given one shake by a Rottweiler dog and then dropped immediately. Again, on the outside of that animal, absolutely no evidence whatsoever that the dog had even touched him. No saliva, no lacerations, no bruising. Our blood tests and sampling of the fluid in the abdomen by way of abdocentesis, however, allowed us to see that he was actually bleeding extensively and that his intestines had very likely been punctured. The post-mortem showed his cecum had been punctured, and as a subsequent, bacteria was leaking into his abdomen cavity, causing a septic peritonitis as well as a lacerated liver. Now, these findings constantly help to guide not only our diagnostic approach, but also our ability to inform other clinicians who might call up for advice on cases that they're seeing in general practice. Now, another big area we're often involved in is the bycatch of wildlife other than fish with hooks. For a turtle or a seabird, this pre-packaged meal just sitting there is just too irresistible not to eat. Oftentimes, members of the public are not aware that these species will ingest the hooks, or they think they'll eventually rust if they just cut the line. So not only is this a fantastic opportunity to help the welfare of this individual animal, ideally this starts with the call for help, where advising to keep the line intact and long and taped or held so that the animal doesn't swallow the line, so we can follow it down. And then once the animal is with us, ascertaining the whereabouts of the hook with radiographs to help guide our approach to removal. Now, there's lots of different techniques in use, but of course the goal is to remove all foreign material. This turtle required surgery to remove the hook, which you can see down the bottom, from his distal esophagus. And then we placed a feeding tube to allow for hydration and food to pass without actually going, that food having to pass by the surgical site. Once the wounds have healed, the tube can be removed, but then we also need to ensure it's the appropriate time of year, and in this case, spring, summer, before release. There's also the opportunity here to introduce the conversation of how we dispose of fishing line and hooks, and then use of alternatives to food bait. So not only is there messaging around the individual's welfare, but bigger picture welfare messaging for many animals that are at risk. Now, I definitely go so far as to say our best welfare outcomes definitely come from collaborations and idea sharing between carers, keepers, nurses, specialists, media, the vet team, and more. Thinking outside the box constantly, but also working to ensure these ideas are providing for least intrusive approaches to care and welfare. Now, the following few videos highlight some of the training programs utilised in some of the workplaces I am at to provide provision of care as least intrusively as possible, but they're also strengthening the trust bank between the caregiver and the animal. I also see some of the techniques used that could be adapted for wild animals in our care to allow for movement from enclosure to enclosure, or for weighing without having to manually restrain, which is one of the big pressures they face on a daily basis a lot of times. Okay, so bear with me. All right, this is our beautiful Stumpy shingleback, who has a few chronic health issues. Now, he's a very well-fed animal, and by using this high-end reward, he's being moved onto this log so we can provide some treatment for him. Now, we've got choice and control here. Stumpy can choose to participate in this exercise. By moving to the log, we're able to get a conscious weight without any handling. His treat of choice is blood drops. So whilst he's enjoying that, they're able to treat an injured scale, but they're also able to apply an eye drop, even while he's happily tucking into this treat. So you can imagine this is a much better result for Stumpy and also for his caregivers than manual restraint, which can be extremely stressful for any animal, but particularly for a small animal, it's going to be held up in your hand. And he goes back to his enclosure for another lovely treat. A little kebab there. Okay, we're going to move on to some larger animals. Our giraffe boys. This is Armani. They can be quite wary of new things, and the keepers here have done just a phenomenal job of training. Target training, as you can see, then moving on to touch with the ultimate goal of conscious blood draw, which is just fantastic because we can get such valuable information from that blood, a conscious blood draw, without anesthesia, which in giraffes can be fatal. And we can even apply this to a bigger animal. This is Pepper, a wonderful, beautiful white rhino who's entering for some training. And as you see, really importantly, choice and control, that front gate is open. So again, she's well fed. She's participating in this training due to the trust and the bond between her and her keepers. Again, for conscious blood draw. It's just fantastic. So when she's ready, the door's open. She leaves of her own accord and heads out to the savannah for a day wallowing in the mud with her friends. Okay, next, this is another great idea by one of the keepers thinking outside the box. She had worked with penguins where we use this technique to check their feet. We had one of our meerkats, Andazi, who had some nail injuries, and we really wanted to check on the progression of those injuries. So first of all, he's having his feet washed in some water, and then he moves across to what's called a podoscope, which is a glass screen with a camera underneath. Just brilliant. So we can happily see how his feet and his nails are looking with this footage. Choice and control, he's choosing to participate in this for a lovely high-end reward. And it's just brilliant because to manually restrain him is extremely stressful. And also if he needs to be removed from the group, he can be the target of aggression on return to that enclosure. So this was just such a great outcome, and adapted further to conscious radiographs of those feet as well. Finishing up now. Alrighty, and this last video is from Animals Asia in China. It's quite a short video, so I just wanted to preface it. On the right, we have one of our wonderful bear team managers, Young Li, And the bear in the middle is Marcia, who is on medications for seizuring. So really important that we can test the levels of those drugs in her blood to make sure they're at therapeutic levels. And this has been achieved by a conscious blood draw. Now, Nat is a vet nurse on the left, and this is the first time that she's tried to take blood from Marcia. And you can just see what a great welfare outcome having this conscious blood with such great training and trust. How good is that? Fantastic. I'm incredibly grateful to play a small part in the lives of so many animals, but also to be given the opportunity to work with so many people who are willing and able to share their expertise with me. I definitely see wildlife vet as part of a team, but ensuring that we're upskilling all the time to be able to accurately diagnose species-specific conditions, build a data bank of prognostic indicators, have a thorough knowledge of species-specific life history and territorial needs, and keeping abreast of the constantly evolving welfare conversation. Absolutely an ongoing learning journey, but one we need to tackle to be able to be best placed to bring this information to difficult clinical scenarios and ensure best welfare outcomes. Okay, so just to finish up, another fish hook, this time in the ventriculus or stomach of a bird. A small animal clinician referred this bird over, and in a wildlife species specific clinic, we were able to provide all of the appropriate medication, surgical skills, husbandry skills, and nutritional needs to ensure a very positive welfare outcome across all of the domains. And there's nothing better than a fully rehabilitated animal being released back to the wild, back to its home. And this is the exact spot that this little guy came from. Happy releaser. Great to see them just doing exactly what they should. Okay, thanks so much for joining me today. Really appreciate it.
Thank you so much, Jen. There was loads there. There was loads. You did work so well to cover as much as you did in the time. Some great scenarios, some great footage. I love that you kept referring back to choice and control as well. So very important. And lovely to see Yang Li doing that blood draw training as well. Love that.
Fantastic. Yeah.
Just so questions. So just one, because with all of that experience and like every day being a learning for you, what's been the most profound learning experience in your career, do you think?
There've been a lot. I think for me though, it's it would be realizing exactly what I've been talking about today, that having the conversation being part of the solution, not going right, okay, I've got an answer here, but does it making sure that you're involving everyone in that decision-making process. Doesn't happen all the time, but trying to be really aware of that and realizing that there's more to being a vet than just fixing an animal that's in front of you. Realizing that, you know, the person who's bringing that in is really invested. And even though it might need to be euthanized, that you're having that conversation together and that hopefully you're going on that journey together. So by the end of the time, they're growing in their knowledge of why you're euthanizing or why you're not euthanizing, as well as what you've already got, so that you're growing together. And the next time that person comes in, they might say, oh, Jen, this one, it's got this and this wrong. Like that learning together is definitely been something that I'm really excited about. Yeah.
Fantastic. Really interesting question from Judy. You talked about the elimination of invasive species to protect indigenous species. Is there a preferred method which is now adopted?
No. So yeah, big area of growth, Judy, and it will depend. So I don't know if you know here, but in Australia we have different state welfare and departments that are in charge of that kind of sorry, I'm rambling on here. So different departments that are overseeing that in different states. So there are different approaches in different states, but that's why those matrices are so important, because they will guide that conversation moving forward. So, and it depends on the species as to which technique is most humane. And it depends who is involved in that conversation and who's collecting the data as well. So it's a tricky area, and it's definitely one that interests me a lot, because I think we need to look beyond this is what we've used forever, we'll just keep using it, when we look at those matrices and see that they're not humane. So I think we can do a lot better. So yeah.
Another question from May. What if animals fail to willingly join a training for their health purpose, and you couldn't check them in the least stressful way? Which is also a good question.
Yeah. Again, it would depend. So if it was in a situation where we had time, where the outcome of that doesn't severely impact its welfare. So for instance, checking those feet. If and Darzi didn't want to participate that day, he doesn't want to participate that day. If it was something that was potentially life-threatening, if he didn't participate, we may have to intervene. And obviously that definitely happens to vets all the time. And it's something that's we don't like doing, where we have to physically restrain or dart an animal because there's no other way of ensuring we can fix a problem that could be, life-threatening or impact their welfare a lot more significantly than leaving it till we can do it in a less intrusive way. But it's constantly part of the conversation again about trying to find more tools, more antecedents to set you up for success, to make those least intrusive approaches usable more often, all the time. So yeah, and it's something that I really like about where I am working, that all the places I work, there's big investment in that training, which is great.
Excellent. This is an interesting one from anonymous attendee. So you've got experience with many different species, which you've done a whistle-stop tour of today. When you switched to a species that you've never worked with before, how long did it take you to learn and be familiar with them, and what was the most difficult? And I don't know if that's the most difficult species or most difficult learning.
Yeah. Yeah, it's very tricky. I immediately, I'm one of those, I'm a pre-preparer. So I like to try and know if there are new species that I'm dealing with, I will go away and study as much as I can. If I know I'm doing a procedure on it, even more so. I think scenarios, some of the very big species where for instance, I've not done a giraffe procedure, but for instance, that kind of scenario, rhinoceros, the big species where there's a lot of risk in anesthesia, obviously that can definitely get your adrenaline flowing. But also, it can also be the type of anesthesia you're using, because for some of the species we're dealing with, we're using very dangerous drugs. So that in and of itself is a big challenge. So it might not be the animal per se, but learning and making sure you're all over the anesthetic that you're using that is not only dangerous for the animal, but can be dangerous for yourself. So, yeah, I think just like I say, every day is a school day. So constantly just learning, constantly.
I've got a question actually. Do you think welfare is always compatible with conservation? I know you've touched on this throughout your talk today, but do you think they're always compatible?
I don't think historically they have, and I do feel.
Oh, you've muted yourself.
Sorry. I do feel, having done the conservation masters and a welfare masters, that did become quite apparent, where some of the gaps were, and I think there's gaps are closing, and also that's being led by it's not spooking anything, but things like organisations like Zoos Victoria, like yourselves, Global Animal Welfare and Wild Welfare. That gap is closing because everyone's understanding in order to have good conservation outcomes, the animals need to be thriving to achieve that as well. So we've got to look at welfare. So I definitely, and I think that's why I touched on some of the areas I did today, that those conversations are definitely at the forefront now and they're happening. So it's exciting times ahead. I don't think we're there yet, but we're definitely aware of them and trying to move to really good solutions.
Thank you. Do you have questions, Simon?
No, I mean, thanks again, Jen. That was really, really interesting and enlightening presentation. And I think you've covered so much of some of the things I was going to ask, like compassionate conservation and public awareness and things like that, which is fantastic. I guess one thing that I always comes to mind when we're talking about vets is that the training and time element for vets, and particularly new vets coming through. And I don't know if you've seen, because obviously you've done lots of further courses and qualifications to build up to the knowledge and expertise that you have. But with new vets coming through, do you feel like they still have or are getting appropriate training when it comes to actual animal welfare and behaviour, opposed to just treating the animals? Because that's always been a little bit of an issue sometimes. And I know there's all sorts of other pressures and constraints that can influence that, but I don't know what your thoughts are on that.
Yeah, I can't speak from a really objective standpoint of knowing what the curriculum is. So I'm being biased here from what I see with students coming through. So I'm not as up with the curriculum as I could be. But with seeing students come through, I think, there's definitely room for more. The language, and I suppose it's also the setting you're in. You're trying to, there's some element of trying to please, but the language isn't about welfare or looking at, it's focused on that pinpoint focus on how we're going to fix that animal right now. What technique are we using, what anaesthetic are we using, not, are you able to house this species, or have we do you think this animal's stressed, or looking at the behavioural repertoire of them, or if you ask about the behavioural repertoire, that might not be part of what they're thinking about. It's just that pinpoint. But I think you can do that when you're young as well. You get very focused, laser focused on the things that you think people want you to say too, don't you? So I think there's always room, isn't there? There's always room for all of us, because the welfare conversation is constantly evolving. So yeah.
No, excellent. Yeah, no, couldn't agree more. Like you say, it's every day's a learning day, isn't it? And or school day. So yeah,
Yep.
No, thanks, Jen. I think I don't think I've got any other questions. I was going to talk about obviously we talked a little bit just then about animal behaviour and things like that, but I guess most vets are very reliant on the keepers being able to deliver the training, the animal training, to be able to work with the animals, you know, without having to capture them or use chemical restraints and things like that. So I guess I'm sure you've seen a big shift in keeper practices and things like that over the years as well, which is always good to see. But again, that's another area that can always be developed, can't it?
Yeah, yep. I'm one of the avid followers of that in my workplace. We're provided with a lot of opportunity to learn about the training and the behavioural side of things. We've got great staff in that, and the keepers are doing an amazing job. I can see so much value for that for the veterinary departments as well, and so can the people who are leading this training within our organisation, that creating those opportunities where we can, when we've got animals up. It's never that easy in the veterinary side of it, because it's usually an animal that's been anaesthetised, that you have to get medications into. But yeah, it's something I often think about, how, like, that's what I was talking about with the wild species. You know, we can use those techniques that we use for Stumpy for a wild lizard in care, you know, to, rather than pick it up and change its enclosure every day, just thinking little things that we could use to decrease their stress. Obviously, is wherever we can, we'll put medications in food items, so it's not being forced into their mouths or anything like that. But that's not always possible either. But just little things that we could start to think about that might, you know, help with the stress, particularly for wild species.
No, exactly. It's yeah, in a zoo or captive environment, then yeah, your focus is especially, you know, in recent times, is very much preventative healthcare, isn't it? So you've got the time to do the animal training, but when you're treating a wild animal, yeah, you have to be very reactive, don't you, and deal with what you've got in front of you. I think we've got another question actually, Nick.
Yeah, Judy. In animals which are going to be released, this is a good one. Training is less likely to be appropriate because of that human contact. Is that a problem, or can it be a problem? I know there's so many variables.
Yeah, I think did touch on that a little bit when I was saying that it's incredibly hard to allow them to thrive, because you can't have those training and that bond. I think there are opportunities for luring, because you can be hidden. It can be the food source that's used to move them. It doesn't have to be you. So you could be behind things. It can be as simple as just having your two cages connected, so they can walk through. So I think it's not so much training, but you can set up the environment or set up your antecedents to allow for movement or less stressful scenarios for some of these animals. By no means do I think I'm across it. It's something that I'm fascinated with and I'd like to improve, because, you know, it's the same with enrichment for wild animals in your care. Like, how do you do that well without providing things that are not natural, that, you know, they're only in care for a short amount of time. So I'm going off on another topic here, but I've talked to people about this before, and it's that balance between interfering or potentially adding stresses, rather than that short-term stress of them being in care, getting fixed as quickly as possible and getting out. So I don't know quite what the right answer is there.
Mm-hmm. Well, the questions are coming thick and fast now, Jen.
Uh-oh. They're like, nope.
So the next one, I think I understand. So when you treat a wild animal, you always have to think about it, whether it's a prey or a predator. And because some drugs could cause problems if taken by the wrong species. So there's some examples over king vulture and ketoprofen in cows. And could you talk more about this problem? I don't know if that resonates with you.
Maybe I should try and read it. Let me have a look. One of my yours. Okay. Okay, I think yep, I get what you're saying. So if I'm releasing an animal that's potentially a prey animal and I've given it drugs that might be toxic to a predator that ingests that animal in the wild. Yeah, it's a good question. I'm trying to think of scenarios and I can't off the top of my head. It is definitely something you should be wary of. More probably pressing is, no, I can't address that one really well for you right now, I'm afraid. Sorry.
I guess there's also the opportunity we can also field any questions anyone has and send them over.
I can think a bit more about those scenarios. Yeah.
Yeah. And then another one, and this is an interesting one, and I think probably again more down to different variables. Do we encourage or avoid wildlife who are under our care to be attached to us?
No. So if we're talking, well, again, are we talking about captive species? So in zoological settings, or are we talking about wildlife? So wild animals. So if we're talking about captive species, there is definitely in a lot of situation, well, in most, a bond, and that's what's allowing for the training opportunities and allowing for healthcare as least intrusively as possible. But with I think that's what we were touching on before about with the wild species that are in and out, in theory, for release, we don't want to humanize. We don't want to build that bond between us. Obviously, we don't want to do that, but how can we use techniques to lessen their stress by setting up their environment? And that might, as I said, that might be hiding with luring, or it might be having the door between two cages to allow no handling. So no, I'm not advocating that we become really allow those animals to become humanized. Definitely not advocating for that at all.
Mm-hmm. Thanks, Jen. We've only got a couple of minutes left, so I've got one more question for you. So what advice would you give anyone who's currently studying to become a vet and wants to forge a career as a wildlife vet? What advice would you give them?
I'd say make the most of as many opportunities as you can. Definitely, I would also say get a good grounding. So it's great if you can, like I was talking about in my bio, that I go out and make the opportunities with people from different fields. So a lot of the field work I've done has not been veterinary related. I've been the person, just the dog's body, doing the data collection kind of thing for someone who's doing amazing work in conservation or in welfare or in, all kinds of different areas. So make the most of those opportunities as well as the veterinary opportunities, things that engage you with wildlife, but get a good grounding in your vet skills. So if you've got that really good grounding in surgery, in decision making, in collaborative approach to clinical cases, you'll be so much better placed to be able to deal with different species and different scenarios than you could be thrown any surgery. But if you've got that good grounding, I think it's a good place to start.
Nice, lovely. Thank you very much. Thank you.
Thank you,
Time has flown. It's gone so quickly, but really insightful and really valuable. And I'm sure everyone who's on the call but knows who'll watch it afterwards in the recording will get a lot out of it. So we're really, really grateful for your time.
I appreciate your being here, and thank you so much for the opportunity. Yeah.
And Judy says, fabulous. Such a joy to listen to you and see your presentation.